Good evening, everyone, and welcome to today's episode of the webinar series. Um, this webinar series is brought to you in collaboration between TFOS, the Teofim Ocular Surface Society, and the CEFI, the Center for Public Eye Health Initiative. Today we have Dr. Kalika with us, who served on the contact lens impact subcommittee. Dr. Kalika is well experienced in contact lenses. She's a postdoctoral research fellow at the Ocular Surface Laboratory in Department of Ophthalmology in New Zealand. Her research interests are in contact lenses, ocular surface. Before now, she had served in the research unit of the Brand Holding Translational Research Unit in India. She also is a fellow of the British Contact Lens Association as well. We're very pleased to have you, and we're appreciative of you taking out the time to do this. So basically, I'm going to moderate. You can actually share your screen. I'll stop sharing mine, and you can take it away.
All right. First of all, thank you so much for the opportunity. I really appreciate it. I understand it's a little late for everybody there, so I hope that I make it worth your while. And should you have any questions, I would like to take them during the presentation. Just feel free to raise your hand, or then if there's anything after the presentation, I'll be happy to attend to them as well. So can I just quickly confirm that you guys are able to see my screen?
Yes, we can.
Yeah, and is it a full screen that you see, or the screen with a little bit thing on the right-hand side?
The screen with a little tab on
Okay,
the left.
I will have to change the screen to the other one. Let's see. Now, can you see the full screen?
Excellent. Yes, we can.
Yeah, excellent. All right. So welcome everybody, and thank you, Binwani, again for the opportunity. I am hoping to discuss a really long summary into small time, and hope that by end of this presentation you would have a little bit more understanding about the current state of literature that is present around contact lens discomfort and contact lens related ocular surface conditions. Like I said earlier, I would like to take any questions in between if you have them. And just in case I don't notice them in the chat box, please feel free to unmute yourself and ask your question, and I'll be happy to address them. And if you don't have any during the presentation, that's all right. At the end of presentation, I'll be happy to take any questions you may have. Now, should you want me to slow down or or speak loudly, just let me know and I'll be happy to adjust those things as well. So let's get started. So, hello, good evening, and my name is Kalika, and I was fortunate to be part of the contact lens subcommittee of the TFOS Ocular Surface Society's this whole effort of compiling vast literature into smaller, easy to understand, however structured and in detailed reports. My committee had 17 authors, and it was led by Professor Lyndon Jones and Professor Nathan Efron. The report itself is 155 pages. However, don't let that put you off from reading the report. It is a wonderfully written report that summarizes over 650 papers. So imagine you don't have to go through all 668 publications. You can rather look at this 155 pages report. We also have included some amazing figures and easy to understand tables that I would like to encourage you to please just go and have a look at them. And they have really nice summaries to focus on. All right. So why is it that we were talking about contact lens discomfort in this paper? What we believe is that since their inception, contact lenses have come a long way, including soft contact lenses. We've improved material, We improved oxygen permeability to make them safer. We include surface properties. We made them smooth, we made them moist, and we made the care solutions a lot more safer and balanced. Now, despite all those efforts, contact lens discomfort is still one of the major causes of contact lens dropout. And that triggered to be included in this report as one of the important segment. You would notice that we have a systematic review included as part of this big narrative review, and that focuses on the reasons for contact lens discomfort. This particular report is split between two major segments, and they are associated with contact lens choices that impact the ocular surface and lifestyle choices that may impact contact lens wear and success. Now, the choices that impact ocular surface are typically the ones that are influenced by clinicians, such as a patient comes to me and I fit them with a contact lens, knowing their history and preferences, and I say, well, a monthly disposable lens may be a good fit for your requirements. So I am, as a clinician, making a conscious choice, and this has impacts on the patient's contact lens wearing journey. Now, there are other choices that patient make, such as their lifestyle choices. If they want to smoke or not, if they want to wear lenses beyond the replacement frequency, or beyond the safe wearing time habits, or if they're wearing lenses and sleeping with lenses, or using lenses while swimming and reusing those lenses. So these are all the different choices that patients make, and that also has an impact on the contact lens success. So I'll be going through the first segment and then the second segment, and would try to elaborate all of these in detail. Hi, Samuel. Did you have a question? Oh,
I
that's
think
all
you may
right.
just go on.
Yeah, that's all right. I just thought I heard something. Okay, no problem. So contactless choices that can impact the ocular surface, such as non-adherent to scheduled contact lens replacement. Now, what I mean by scheduled contact lens replacement strategies are every manufacturer recommends a particular replacement for contact lenses. For daily disposable, it's like use them once and throw them after use. For bi-weekly disposable, you're supposed to take care of the lenses for up to 2 weeks of wear, and then at end of 2 weeks, you're supposed to throw these lenses. Similar is the case with monthly, it's just the duration is increased from 2 weeks to 1 month for monthly disposable lenses. Now, patients sometimes have a tendency to use the lenses beyond what has been recommended. Now, this is where they're taking a risk. And what happens when they do that? There's reduction in comfort and quality of vision. This is particularly an issue if a daily disposable contact lens wearer moves from daily disposable routine to a reusable routine, such as biweekly or monthly. Now, what are the more complications here is because they are not used to taking care of their lenses beyond daily disposable routine, and hence they are at a higher risk. As a clinician, what we can do here is to remind them of all the rules that we expect them to follow with their contact lens, so they will have a safer and healthier ocular surface and contact lens wearing experience. What has been found is that up to 10 to 15% of these patients reuse their daily disposable lenses as well. And that is obviously not recommended or healthy. The lenses are not designed for reusing. Some also inappropriately store their lenses, such as in tap water or blister pack. This is because a monthly disposable wearer or a bi-weekly disposable wearer would have a lens case and would know how to take care of the lens case. They would also have a lens care solution. So together they are used to taking care of lenses. Now you take a daily disposable lenses, typically it doesn't come with a case or care solution. What you do then is you tend to reuse the lenses, risk the health of your eyes, and store them in tap water or blister pack. If you are familiar with Professor Nicole Khan's work, Associate Professor Nicole Khan's work, you would know that the contact lenses and water should not be mixed together. Using tap water increases significantly the chances of developing microbial keratitis, which is a sight-threatening condition. There are other unsafe practices that can lead to microbial keratitis, such as sleeping in contact lenses and ranges all the way to topping off contact lens solution. Sleeping in contact lenses was found to be one of the most effective condition or factor to be associated with microbial keratitis, and least was topping of contact lens solution. Worth noticing is that, just a second, I'll get my laser. Yeah, worth noticing is that smoking was higher than topping of contact lens solution. So we have to encourage our patients and increase their awareness around habits if they are contact lens wearer and if they are in the habit of smoking. They need to be aware that there's a higher risk of developing infection, and hopefully they'll make changes in their lifestyle. Now, infiltrative keratitis is another complication we do not want our participants to experience. Infiltrative keratitis has a lot less, about 12% less risk of development if daily disposable lenses are used. Now, should you see a patient with recurrent corneal erosion with their contact lens wearer, where you might want to shift them to daily disposable lenses because they will have a lot less chance of developing uh, infiltrative keratitis. Now, daily disposables have been found to be increasingly popular among clinicians and patients. They are easy to maintain, they have greatest level of convenience, and because they're easy to maintain, they also have most compliant rates. So consider recommending daily disposable lenses to your patients if that suits their lifestyle. The other segment that we wanted to focus on was the choices or the lifestyle choices that the patients make. Some of them are modifiable, others are not, but we've included them all. These are the 9 important segments that I will be talking in my talk today. Supply chain. So, purchasing contact lenses through unregulated outlets and avoiding frequent follow up care, usually done to reduce cost or time, carries increased risk of contact lens related problems. Custom or decorative lenses, the lenses that make your eyes look different, are usually not consistent in their parameters and usually not regulated by the government procedures to or checked properly. Hence, there's variability in their quality. No wear and care advice usually is provided because these lenses are used occasionally, ordered online, used and thrown, but without being aware that they could have dangerous consequences for the eyes. Strategies to ensure provision of adequate hygiene, safety education, and ongoing connection with an eye care professionals are needed. So, when you see a patient, it's not just important that the appointment is done properly, it is the follow up and reminding them all the time, very frequently, as to what is expected out of them to take care of their lenses. Now, this is important even if they are habitual contact lens wearer. As we use lenses, we might have a feeling that, excuse me, excuse me. We might have a feeling that we're doing everything okay, nothing's gone wrong with the eyes, we can continue doing those things. And people may tend to not look after their lenses as well as they used to. So it's important that we remind them. And having these strategies planned out in your clinic are absolutely important. The second one is related to health and aging. So there are many beneficial medical indications for contact lenses. So it's not all negative about contact lenses. We really like them, and if worn properly and safely, contact lenses can impact quality of life significantly and improve it significantly. There are concerns about can contact lenses be worn in allergy, and it has been found that with allergies, contact lenses provide higher level of comfort. There's also an option of contact lens that is anti-allergy drug delivering contact lens. So that is a really good thing. Typical contact lens associated risks were not directly impacted by the pandemic. So during this review process, we had a lot of papers that were published in pandemic related to the pandemic, and those were included in the review as well. However, pandemic related infection did not show significant impact. Related factors did, such as mask associated dry eye, increased screen time, and exposure to hand sanitizers. There were certain areas that came across as unstudied areas or understudied areas. In those where can somebody who is experiencing upper respiratory tract infection viral wear contact lenses. So there is evidence related to microbial keratitis risk in wearers who are unwell, determined inconclusive in recent review. So, evidence does exist of a link between being unwell and occurrence of corneal inflammatory events associated with contact lens, where, however, we think that there are more studies required for us to understand a relationship between a generic illness and the impact on contact lenses. Systemic diseases, as we would expect, affect the success of contact lens wear, such as diabetes and thyroid disease. Existing ocular surface condition can also result in contact lens discomfort. Age and health of contact lens wear impact ocular surface and continued contact lens success. Young kids have been found to be successfully wearing contact lenses, and some studies even show that the young kids have less adverse effects compared to the adults. However, with age, other ocular conditions such as dry eye disease and meibomian gland dysfunctioning increase, and these have an impact on contact lens wear success. Wearing contact lenses after cosmetic or refractive surgery can also be problematic. This is because your shape of the eye or the lids changes after these surgeries. Hence, the environment in which the contact lenses are worn, every time you blink over contact lenses. The contact lens has a relationship with the corneal conjunctival surface, the tear film, and the lids. So after a surgery, this relationship changes significantly, and that has an impact on contact lens success. In the paper, you would notice we have this really amazing figure that summarizes management strategies for contact lens discomfort. If I could bring your attention to these three segments, so the one in blue, the one in green, and one in purple. There are bits on the top and bits on the bottom. I will be now describing them just in a bit. All right. So if the contact lens wear is successful, obviously we don't want to make any changes in that segment. However, if it is not successful, that's when we get into management strategies to make this successful. So we need to assess and identify factors related to poor success. These could be lifestyle factors, environmental factors, health and contact lens related factors. Now remember, some of these factors are modifiable while others are not. Most of the times, it's only on modifiable factors that we can act on. The next is intervention on modifiable factors. So among lifestyles, these were the modifiable factors, and that is how you can influence them. So you can influence them by counseling the patient or advice on lifestyle changes and nutrition. Environmental factors, some of the environmental factors are modifiable, such as if you're sitting right in front of an air condition, or if the air condition is blowing air right above your head and you're looking at computers, which we are all guilty of doing. We look at screens and computers all the time these days. So these are the things that are modifiable. We can advise our patients to change their sitting arrangements, have a reminder app to blink, and take frequent breaks. So these are some of the things that we can help advise our patients. And then obviously manage any comorbidities if they're there, fix suboptimal contact lens related factors as well. Now, when we do that, we need to follow up and see if any of these modifications have helped our patients. If not, we may have to work on other factors and bring a lot of different changes to make sure that the contact lens wear is being successful. Now, it is possible that you would be moving between these steps quite often until you use or reach success. Please go through this figure later again with some, give it some time, read it, have it handy in your clinics, and it will come very useful. Environmental factors, well, pretty much anything that can go wrong with environment can impact contact lens success and performance, such as low humidity, high altitude, pollution, wind, dust, and fumes. Now, decreased air temperature and relative humidity result in a thinner pre-lens tear film, less stable tear film, increased tear film evaporation, and increased dryness. All of these can impact vision and comfort, or vision or comfort. Many published studies were carried out using contact lens types and materials that are no longer available. So we need to have newer studies with newer material to see if there's any difference. We see contact lens materials are evolving every day, and with newer materials, newer studies need to document the evidence base around these materials. Occupation, sports, and recreation has a major positive impact or negative impact on contact lenses. People who like to do sports or active lifestyles tend to prefer contact lenses over spectacle because of the convenience associated while performing their high impact activities. However, there's digital device overuse these days that seem to be increasing, and we cannot seem to be able to avoid it. So with that, it's important that we incorporate increasing awareness around blinking. And why is it that's so important a patient blinks, specifically with if they are contact lens wearers and if they tend to use digital screens a lot? Contact lens wearers need to be fully corrected to perform optimally. So, multifocal lenses have been found to be a lot more successful compared to monovision therapy. With newer designs and model, even multifocal contact lenses are finding really good success rates in most of the patients. So that is an option we don't consider enough, and I think we should look into that. And there's fully corrected low levels of astigmatism also improves the quality of vision. And earlier, it was recommended that if there was small amount of astigmatism, you just prescribe them spherical lenses and hope that they'll be okay with it. With newer stabilization techniques, I think even the small astigmatism can be prescribed and corrected to give them better quality of vision. Occupation, sports, and recreation. Also, during sports, contact lens often preferred, like I said earlier, because of their advantages over spectacles. Industrial hazard exists in which contact lens wear can be problematic, such as foreign bodies, chemical fumes, vapors, aerosol droplets, makeup, etc. Impact of altitude is another really important thing. A lot of people are now paying attention, considering they are near possibility of space travel becoming a affordable reality and people wanting to experience it. So there is a lot of interest around that area as well. Non-compliant and risky behaviors, as expected, are associated with higher rates of contact lens discomfort and reduced contact lens wear success. 99% of the wearers report at least one contact lens hygiene risk behavior. Now, that is scary. We expect a lot from a patient. It's really hard for them to keep up with everything that we ask them to do with their lifestyle and everything else around it. So 100% compliance rate is really, really rare to find, and it fades away as they increase their contact lens wear time. So it's important that we re-educate them and refresh their knowledge often and frequently. 1 million visits in USA occur for keratitis or other contact lens complications annually, costing estimate at $175 million per year. This is just US. If we had the information from other parts of the world, we would increase, and I can only imagine how impactful those numbers would be. Several complications in lens wearers have been reported when wearers smoke tobacco, marijuana, or electronic cigarettes, called vaping otherwise, or other under the influence of drugs and excessive alcohol intake. So, increasing awareness around these issues is something eye care practitioners can do to help improve contact lens related success. There is a lot of excitement around smart contact lenses and what potential future of these smart contact lenses would be. There are several developments currently undertaking, and it won't be long enough before we have these lenses available for use widely and commercially. These lenses can be used for diagnosis and ocular drug delivery. And it would be really exciting. So there was a lot of literature on the development of the lenses. However, the clinical performance in market, there isn't much available because they've not yet been commercialized to scale. So that is something that we should keep an eye on. And as and when these type of lenses become available for everybody, we could be studying more about them. And as you can see from this literature report, that it is absolutely important that we publish work and that is available for everybody to grasp knowledge from. So there's impact of stress, depression, and physical inactivity on contact lens wear success as well. Dry eye patients report greater level of stress and depression, so that is directly associated with contact lens wear as well. So these are the potential areas for future contact lens research to determine if stress, depression, and physical inactivity affects the contact lens success, and how exactly does it affect that. Contact lenses impact on quality of life. Like I said earlier, it's not all negative about contact lenses. Many people find wearing contact lenses as a rewarding experience that improves their quality of life. Contact lens wear result in a better quality of life than glasses in many cases. And there's also improved quality of life in pediatrics and keratoconus, which is significant improvement. Impact of contact lens wear on the environment is another thing that industry is focusing on and which we are really pleased to see. With daily disposable contact lenses gaining popularity, now there are a lot of blister packs, a lot of plastic waste, and the industry is working with clinicians and other societal members to try and reduce this impact on the environment. We also included a systematic review, which I was also part of. So I was not only part of the narrative review committee, I was also doing the systematic review for the subcommittee. And this review focused on association between lifestyle factors and soft contact lens dropout. Please do have a look at this. This is a smaller segment and would help you understand things significantly better. And why is it that contact lens discomfort and dropout are so closely associated with each other? So the prominent risk for reasons for dropout were less discomfort and vision quality. A need exists for research to specifically examine the lifestyle factors associated with soft contact lens. So we did do the systematic review. However, we think that there was a lack of good quality research design and papers describing these aspects. So we highly encourage everybody to consider incorporating good research designs, and then we would be able to synthesize the outcome of the study a lot more significantly. In conclusion, some lifestyle choices stress successful contact lens wear. When appropriate lifestyle choices are made, contact lens wear can enhance the quality of life of wearers, and several areas of study lack high quality evidence and would benefit from further exploration. And these are some of the areas that I wanted to highlight as well. With this, I would like to acknowledge Professor Lyndon Jones for providing the slides that I used in today's presentation. And these are all the sponsors that helped TFOS, enable TFOS to create this global impactful reports. And we would like to thank all the sponsors. I personally do not have any financial disclosures associated with this particular presentation. And yeah, thank you very much. Now, should you have any questions, I would be happy to take them now.
Thank you so much, Dr. Kalika. I'm
No
sure we
worries.
all benefited a lot from that.
Yeah, I see there are some questions.
Yes, there are. So
Yeah,
I just read them out one after the other, and
that'll be great. Thank
you
you.
can give the answers.
Yep.
So the first question is from Dr. Mason, and she asks
Mhm.
about diet and the impact of diet on contact lenses. I do know there is a subcommittee section that looks at the impact of nutrition on
Yeah.
ocular surface disease, and Dr. Barbara Cafe would be
Mhm.
handling that in 2 days' time.
Yeah.
But
Yeah.
in regards to contact lenses, her question is, can change in diet have any impact on contact lens wear? I'm going to assume that's on contact lens comfort or discomfort.
Sure. Thank you so much for the question. That's a very interesting question and really important one. And like Obinwane said, that part of it may be covered in the other subcommittee reports. We did not want to include or have a major focus on nutrition as such because we think that the nutrition affects the ocular surface, and that effect of ocular surface then affects the contact lenses. So, if through the other report we understand the impact of nutrition on ocular surface, then that would directly be related with contact lens success in those cases. Now, does nutrition impact contact lens wear? Yes, it does, but it does that through the impact on the ocular surface. I hope that addresses your question.
Yeah, so I'll just add to that. So certain foods may be pro-inflammatory. So whatever diet an individual has that may cause certain inflammatory responses in the body may also show up in the eyes or in the tear film with inflammatory mediators, and that can impact contact lens comfort. So thank you so much, Dr. Kalika. So the next question is from Dr. Odum Elsie. And she asks, is it safe to have daily disposable contact lenses on day and night? I'm assuming she's asking if it's safe to sleep with daily disposable contact lenses.
All right. So, it is never safe to sleep with your contact lenses. Closing your eyes for a few seconds or minutes is okay. But if you want to be sleeping your contact lenses, as you would have seen, sleeping in contact lenses has the highest impact on development of microbial keratitis. So that should be discouraged even if the patients are daily disposable contact lens wearers. Uh, I, I might add to that, especially if the patients are daily disposable contact lens wearers, because daily disposable contact lenses are made differently to reusable contact lenses. And yes, so please do not encourage anybody to sleep in contact lenses. It's not safe, no matter what type of contact lenses you use.
Yeah, I'll just add to that. You also mentioned in the course of your presentation that daily disposable contact lens wearers are usually not prescribed multi-purpose solutions. So they end up using tap water or saline to store the lenses or clean the lenses, which is not safe. So it's a big no-no.
Yeah.
All right, so your next question comes from Dr. Sandra, and she
Mhm.
asks, how can dysbiosis in the ocular surface affect contact lens comfort in adults?
Could you repeat that for me? How come what
So
affects?
she's asking, how can dysbiosis of the ocular microbiome or the ocular
Oh.
biofilm affect contact
Mhm.
lens comfort?
All right. Unfortunately, I haven't studied much in that area. I can only tell you that anything that affects the ocular surface adversely, contact lens wear can further adverse the condition and environment, except for a few conditions where contact lens wear would improve the ocular surface, such as, like we said, in allergies. And if you have just had a surgery and you want to have improved comfort, in those cases, yes, contact lens can improve. But in most cases, if anything affects the tear film or the ocular surface, it would have a higher impact if these people were to use contact lenses.
Yeah, so just to add to that, your answer, thank you very much for that answer. I think there's a paper by Nathan Efron that looks at how contact lens wear is pro-inflammatory. And again, placing a contact lens on the eyes may change the microbiome because you're going to touch the lenses with your fingers. Also, depending on how it's kept in the case and things like that. But it's not always thought of as a bad thing because that change in the ocular microbiome is sort of, it prepares or puts the eye in a pro-inflammatory state and prepares it or keeps it ready to fight off any invading organism. However, in cases of risky behaviors like Dr. Kalika has explained in detail today, it is possible that you introduce a higher load of microbiome to the ocular surface from poorly washed hands or bathing with the lenses or using water to clean the lenses. And that kind of change in the ocular microbiome can be a source of infection. So again, this points to how lifestyle behavior can lead to ocular surface disease. And thank you very much, Dr. Kalika, for today's presentation. I'll go to the next question, and this is from Amir Ali. And he asked, what are the common systemic medications that can have an effect on contact lens comfort? And are these medications that have ocular surface dryness side effect or something else? So basically, he's asking, are there medications that, systemic medications that could lead to ocular surface contact lens discomfort in contact lens wearers?
Yeah, thank you for that question. It's an important one. Yes, medication, systemic medication impact the contact lens success rate. Particularly if there is a chronic use of systemic medication, such as for diseases that need constant care. Uh, in like when I say any anti-inflammatory conditions can impact ocular surface, and when you take medicine, sometimes an anti-inflammatory response is generated in the body as well that impacts the eye and hence the ocular surface and contact lens discomfort. Now, to give you some of the examples, in diabetes or in hypertension, there is a need of chronic medication use. Also, if somebody's undergone a major surgery, they would be on high antibacterials, antibiotics, antivirals. All of these, particularly if they are used for long duration, would have an impact on contact lens success. You would also notice that when people are in distress related to diseases or otherwise, we usually recommend them not to wear their contact lenses because that can impact their comfort.
Yeah, thank you so much for that answer. Um, the next question comes from Dr. Dipali, and she
Mhm.
asks, what could be the constant recurrent superficial punctate keratitis for a child, despite following care and regimen, despite using lubricants with the contact lenses?
Sure. So there is a really high chance of developing SPKs in children as well as adults, particularly if they are in their adaptation phase. Uh, SPKs are not uncommon. However, we need to monitor them regularly, especially in case of kids. We don't want them to have any nasty infections. Uh, there is also a recommendation that we don't give them full-fledged contact lens wear on day one, and we gradually see if things are moving okay. But are SPKs common? Yes, they are. Can they be managed? Like you said, with the lubricating eye drops, you can manage them or reducing the type of material or the lens fit. What is important in these cases is to identify the root cause and then manage your contact lens prescription strategies around that. So SPKs are common in children and adults. I do not know if there's any difference between the two. I would suspect there won't be. But yeah, they common and need to be addressed regularly and followed up regularly.
Yeah, thank you so much for that answer, Dr. Kalika. Just to add to that as well, it's also possible that you may want to take a look at the preservatives in the solution, multipurpose solution that you're using, because sometimes the contact lens acts as a sponge and then slowly releases that to the ocular surface. But like Dr. Kalika said, these have been shown to be sort of temporary and they sort of fade away with time, with continuous wear. However, you want to build up the wear and not just push the kid into full contact lens wear mode from the beginning. So the next question is from Dr. Peter, and he asks, is contact lens advisable for women going through hormonal changes, which have a higher risk of dry eye syndrome?
Yeah, so we cannot deny contact lens wear during your hormonal periods. uh, that can be tricky because when women have all these hormonal cycles, things around their body go all over the place. The inflammatory mediators and expression of cytokines in the eye has been shown to change significantly. However, there's no indication that they should stop wearing contact lenses. But should it go to a level that the discomfort is too much, then it's okay. It's a choice, but that is not a medical recommendation that if you're going through hormonal changes, oh, don't wear your contact lenses. That is not a medical recommendation we go with.
So I think that's about all the questions from the participants.
Cool. Well,
I do
that
have a
was some
question of
really
my own.
wonderful range of questions. And
Yeah,
I'm happy to take yours as well. But I'm really happy that the audience had so many questions. That's really
yeah,
good.
exactly. Shows good participation.
Yeah.
Um, before I think somebody else just popped up a question, so I'll take that
Hmm.
person's question before my own question.
Of course.
Um, so he asks, um, just give me a minute.
Don't worry about it.
Um, let's go down. So he says during the talk, you highlighted the potential risk of infections in people who smoke. What is the underlying cause of this? So you did mention smoking as a risk
Yeah.
factor for contact
Hmm.
lens discomfort,
Hmm.
which was surprisingly higher than topping of solution.
I
So,
know.
so could you throw more light on that?
Sure. So what I could tell, just to address Obinwane's last comment first, that it was surprisingly higher than topping off contact lens solution, and that could be because smoking is a factor that we always report and take history in any clinical study we do. So that is why it is possible that the smoking related risks are reported higher than topping off. these solutions. When we talk about talking of these solutions, we're specifically looking at that particular studies. So I think there is a little bit of artificial influence on the outcome. However, smoking is an important risk factor for many things in life, and underlining mechanism associated with smoking and contact lens discomfort is not fully understood. Overall, smoking overstimulates the body. Overall, smoking produces cytokines that are usually not needed in the process of overstimulation, and that has been shown to have some impact on discomfort and the environment in which our contact lenses are worn, the ocular environment. So that is the closest we are to understand how exactly smoking affects the contact lens discomfort or associated increased risk of myopia and microbial keratitis. Also, uh, like I said earlier, risk-taking behaviors are more in people who tend to have addictions such as smoking, and then that indirectly also affects the way they deal with their contact lenses. So these are all interrelated complex relationship, but exact underlying physiological mechanism of smoking associated with contact lens wear is yet to be completely understood. But there's hyperstimulation of inflammatory mediators is one of the closest link we know so far.
Thank you so much, Dr. Kalika.
Right.
I will go ahead and ask my question now. I have a couple of them, but I'll just ask what I think is probably a burning issue around the world. We know that the myopia management boom has seen an increase in contact lens prescription in children. And in your opinion, and from the TFOS contact lens impact paper, do you think that practitioners need to be more proactive in looking out for dry disease in these patients and talking about contact lens discomfort?
Of course. So what is happening is we want them to not develop myopia first. And if they have, we want to reduce the progression rate. And contact lenses have shown to have some positive impacts on that, and that has excited everybody. It is likely that the focus would become on managing myopia, but it is absolutely important that we also look at other things. We know that contact lens wear is a known risk factor for development of dry eye disease. And if we start it as early as young children, we have to know that the ocular surface is getting stressed and would be stressed for a longer lifespan for these children. So absolutely important to include assessment and regular follow-ups, not only to see how their myopia progression is going, how their ocular health is going as well. Breaks are important. And as you would also notice that we're living in a digital world these days, even children spend a lot of time on digital devices. So if their children, they're wearing contact lenses on regular basis and they're spending time on digital devices, they will not be blinking properly. Now, non-blinking properly will affect their contact lens wear two ways. One is to not moisten the ocular surface properly and have that visual discomfort and intermittent vision effect through their contact lenses. Other, if they don't blink properly, the pre and post lens tear film is not going to get replenished, and that is going to develop some other oxygen related issues in their contact lens. So yes, absolutely important to co-manage this condition and be aware that we are producing a generation who would have been exposed to a silicone piece stuck in their eyes for a long time. So, yeah.
Yeah, I totally agree with you. And I'm of the opinion that when we discuss myopia management, especially with contact lenses, we need to talk about contact lens discomfort and ocular surface disease together with that.
Yeah. It needs to be delivered as a package. You're right.
Exactly. So I'm going to give one more question and then I'll go back to the audience. So seeing that we practice, this webinar series is meant for the African practitioner. And in Africa, just like in other developing parts of the world, you tend to have a lot of unregulated use of cosmetic contact lenses. In your opinion, what do you think as eye care practitioners we can do about this? And what are the dangers of unregulated contact lens practice?
Well, I'll tell you, it's not just the developing countries, it's everywhere. I think it's under talked about. Developed countries are as bad as developing countries. Trust me on that. Uh, I think it's morely associated with social media and cosmetic appeals and being cool and funny. In those things are hard to control. Uh, they People are young, they want to experiment and explore new dimensions and have some fun. Strategies need to be addressed by government. That is only when there would be meaningful society level impact. As an eye care practitioners, for example, if Halloween is a big thing there, before Halloween running a campaign to increase awareness around the risks that they can be gain. Also, if you're doing your school camps and college camps and higher education camps where you go for screening, it just helps to have a big bold poster and talking about how dangerous unregulated manufacturing of contact lens and using that contact lens could be. So yeah, as eye care practitioners, we can increase awareness, but if things happen at government level, to not let anybody produce such lenses would be really awesome.
Well, thank you so much.
Don't worry about
So
it.
I'll go back to the comments from the participants. So Dr. Levi says, I think smoking has been linked to dry eyes, which could
Yeah,
influence the tear film and affect contact lens wear and comfort. Absolutely,
yeah.
absolutely agree, Dr. Levi. Thank you so much for that input. So Dr. Choma has a question. She says, will an individual with diabetes, dry eyes, and hay fever, although controlled with meds, be considered unsuitable for contact lens wear?
Yeah, I don't usually go with regular guidelines as such in cases like that. So if these people are habitual contact lens wearers and their quality of life is a lot better, with contact lenses and they don't like spectacles, why not? But maybe choose daily disposable to reduce the chances of any further complications, at least during that time when they're not feeling their best. So yeah, I don't see anything as a major flag. And should there be a major flag, typically is reflected as a discomfort. So all we have to tell is it's okay for you to use your lenses during this time if that is what you must do. But be extra aware if you're experiencing any discomfort, and should you experience that, please immediately discontinue your contact lens wear. And if it goes any worse, come and see me.
So I totally agree. And to add to that, I think first of all, the key word here is you said these conditions are under control. So if they're under control, go ahead and put them into a regimen, contact lens wear regimen that has the least risk. Like she said, like Dr. Kalika said, daily disposables, give close follow-up, monitor them closely, and be proactive. So you may not want to wait for the patient to complain. You want to seek those symptoms yourself. So say they come in for a review, you may ask, how's your contact lens wear? Is it comfortable? And most times patients will say yes. However, sometimes you may want to go further and say, how is the comfort at the end of the day after you've worn the lenses for a while? So that makes you be proactive. Look at the leads, look out for MGD, express the glance, things like that. So be proactive so that you can pick up these things before they become an issue. And as Dr. Kalika said, if there's discomfort, re-strategize.
Yeah, like Vinwani mentioned, something really important just now is to measure their discomfort. So, incorporating a questionnaire in your routine follow-ups and at baseline is really, really important, because changes in the questionnaire score can say a lot more than they are able to express.
Exactly. And Could you give us some examples of those questionnaires?
Sure. So contact lens discomfort, CLDEQ8. So
Okay.
contact lens dry eye questionnaire 8 is one of the commonly used, freely available, simple and easy to use questionnaire. And if you don't want to do that, it's okay. You can have a visual analog scale for your clinic. Put how the pain is extremely high at the point 10 and not at all at 0, how their comfort is. So it doesn't have to be a complicated questionnaire. These are freely available. If you think that they're also available in local languages, incorporate them. If not, a simple visual analog scale. However, keep it consistent between visits. That's only when you can monitor the changes in them.
Yeah.
So really simple things help and take us a long way. Yeah.
Yeah. Thank you so much for that. So I'll go to the next question. So quickly, someone asks, can alcoholism affect contact lens comfort?
It does. It affects everything in the body, including contact lens discomfort. If somebody is alcoholic, imagine how they will be looking after their eyes and contact lens. So even if they have worn the lenses while they were in their full senses, being alcoholism changes your body within. Uh, and yeah, I wouldn't risk if I knew somebody was an alcoholic. I wouldn't risk them putting on a contact lens in. Yeah.
All
So
right.
it's important that our patients are able to afford these lenses. But when I say afford, that doesn't just mean money wise. Mean that do they have the capacity to take care of their eyes and the lenses as good as they can to allow them safe experience with contact lenses.
Yeah. Thank you so much for that. So we'll just take the last question before we sign out. Okay, so this is not a question, more of a contribution from Dr. Levi. So he says, some authors do suggest reducing wear time in patients who sort of have other comorbidities, like the diabetic patients
Yeah,
with hay fever and stuff like
yeah,
that. So
yeah.
absolutely, Dr. Levi, thank you for that. And he also goes further to mention that anything is better than nothing. And if you're improving the quality of life in a patient with diabetes, that's huge. So Levi is, he does research with a lot of diabetes
Oh,
patients.
that's
So I
wonderful to
think he's
know.
passionate about that.
Yeah.
And obviously, yes, improving the quality of life in these patients is important. So if contact lenses contributes to that, yay for us.
Yeah.
All right. Thank you
Wonderful.
so much, everyone, for joining in. Thank you so much, Dr. Kalika, for making out the time. I know it's very early for you in the morning. It's 7 a.m. there right now, is it?
Yeah.
So thank you so much. Have a nice day. And for the rest of
Thank you.
you, enjoy the rest of your evening. The recordings will be made available. Also, we'll be sending the TFOS Dues 3 survey to learn about dry practice in your area. But if you have any further questions or comments, you can send via an email. Dr. Kalika, if you could stop sharing your screen, I'll just put up the
Sure.
emails
Of
so that
course.
everyone sees that. Um, okay, I'll share my screen. Yeah. So you could send us an email. We'll be happy to respond, take any questions or contributions that you may have. Also, we'll be sending a survey link for the dry eye practice survey. Please do fill the link. We'd like to know how you manage dry eyes in your area. And the TFOS Due 3 conference will be coming up in October. We'll also be sending a link for those who are interested in attending. Once again, thank you everyone for joining in today. This has been absolutely wonderful. We are absolutely grateful, Dr. Kalika, for your time and your
Oh,
expertise. We
no.
wish you all the best. Thank you so much.
Thank you so much. Thank you all the audience and thank you for all your efforts to organize this. You're doing great service over the morning.
Thank you so much. Thank you.
All
Have a
right.
nice day.
See ya.
Yeah, bye.
Bye.